All right, I think I actually have this time here for my YouTube. Just went on before and it did not come up here. Something had a technical difficulty here. But good morning. I just want to say thank you for joining me today um, on this live session where we'll delve into some crucial updates and strategies regarding Medicare as we navigate through 2025. I'm Chris Newpower. I'm a licensed Medicare advisor, dedicating to help you make your informed decisions on your about your healthcare coverage. Today we'll explore several key topics: the importance of early enrollment and Medicare supplement and Medicare Advantage plans, the new $2,000 out-of-pocket cap for Medicare Part D, changes in Medicare Advantage plan, and networks starting in 2025. Medicare's recent decision here on coverage for weight loss drugs. These are topics are vital to ensuring that you have the best possible coverage and avoid unexpected expenses. Feel free to drop any questions, comments in here, and also if you enjoyed this type of stuff here, please like, share, and let other people know about it. So the importance. Start off here first with the importance of Medicare enrollment, the Medicare supplements, Medigap, as some people know it, also has Medicare Advantage plans. The objective here is to emphasize the benefits of enrolling early in Medicare plans to avoid penalties and secure comprehensive coverage. The way I'd like to also say that too is that you just know what you're getting into. You're educated. You're not just selecting something at the last second, and most critically is that you're fully aware of everything that you're going to be getting and what you're not going to be getting. Because remember, things like dental and drugs that is not going to be covered on regular Medicare. Okay, so let's begin by discussing why early enrollment in Medicare supplements, also known as Medigap and Medicare, are so crucial. So Medicare has specific enrollment periods that are essential to understand. Initial enrollment period, which is IEP. This is a 7 month window that includes 3 months before you turn 65, the month of your 65th birthday, and 3 months after. During enrolling during this period ensures you have coverage when you need it and helps avoid enrollment penalties. The general enrollment period, if you miss your IEP, you can sign up between January 1st and March 31st each year, but coverage won't start until July 1st, and you may face late penalties. Now, failing to enroll during your IEP can lead to late penalties for Medicare Part B. You could pay an additional 10% for each full 12-month period you were eligible and didn't enroll. For Part D, the penalty is calculated by multiplying 1% of the national base beneficiary premium by the number of uncovered months you were eligible but didn't join. So delayed coverage, that late enrollment means your coverage could be your coverage could be delayed, leaving you without insurance when you might need it most. So the benefits of an enrollment period here, excuse me here, ironically, that might have been the same time, even when I was on my Instagram live earlier when YouTube wasn't working. But the comprehensive coverage here, enrolling early allows you to choose from a broader range of plans, ensuring you get coverage that fits your health needs. The cost savings are you're going to avoid penalties. Securing a plan early can lead to significant financial savings over time. You also have peace of mind, which that isn't a dollar amount on that, but knowing you have your healthcare coverage sorted out allows you to focus on other important aspects of your life. So, some action steps for you here is mark your calendar, know your initial enrollment dates, and set reminders. Don't put this off; it's not worth it. Assess your current needs. Consider your current health status, preferred doctors, and any medications you take. Consult a Medicare advisor. Speaking with a licensed professional can help you navigate the options and choose the best plans for you. Remember, early enrollment is not just about avoiding the penalties, it's about ensuring you have the right coverage when you need it. understanding now to move on here, understanding the new $2,000 out-of-pocket cap from Medicare Part D for 2025. And also remember, at any given time here, feel free leave comments. I'd love to be able to answer them for you here. And if I can't answer them during the live, if I just don't see them pop up, I'll definitely make sure that I get back to you afterwards. And remember, all times too, you could always to schedule a consultation. Go to chrisnewpower.com/Medicare. So, and that's Chris with a K, KRIS Newpower at .com/Medicare. So um, to discuss the significant change to Medicare Part D in 2025 is the introduction of the $2,000 out-of-pocket spending cap. Excuse me. The current structure of Medicare Part D, or last year's model, was Medicare Part D provides prescription drug coverage. Currently, beneficiaries may experience high out-of-pocket costs, especially if they require expensive medications. What's changing in 2025 is starting January 1st here, which of course is just 3 months ago. There will be a $2,000 annual cap of out-of-pocket expenses for prescription drugs covered under Part D. This means that once you spent the $2,000 on covered medications, you don't have to pay any more out-of-pocket costs for the rest of the year. Now, for beneficiaries, this is some financial relief. This cap provides significant financial relief, especially for those who rely on high cost medications. But knowing there's a maximum limit helps in better financial planning and reduces predictability of medication expenses. This also is something where you're going to want to have the conversation with a Medicare advisor to help you better understand which plans are going to work better for you, either a gap or an advantage plan. Remember, not one is good for all, and not all is good for none. So make sure you have the conversation. It's got to be tailored around you and your needs. The $2,000 cap includes all the deductibles, co-payments, and co-insurance for covered Part D medication. However, it does not cover medications that are not covered under your plan, over-the-counter drugs, medications obtained outside your plan's pharmacy network. So make sure the prescriptions you need are covered by your Part D plan. This is crucial for the cap to even apply. And why is this a big deal? I'll give you a quick story here. A client of mine, I'm going to call her Joan, was spending $5,000 a month on specialty medication. That's $6,000 a year under the new rule starting in 2025. Her maximum out of pocket would be $2,000. That's an instant savings of $4,000 a year. And when you're living on a fixed income, that is huge. Okay, this is especially important. Excuse me, if you take brand name or specialty drugs, have multiple prescriptions, you're on a fixed income. Those are going to be a big consideration for you. So what do you do about it? Do a prescription review now and make sure your plan will cover your medical needs in 2025. I do this for my clients all the time. Just go right to my site, like I said, submit the form, and we'll be giving you a call shortly. All right. Now, you also want to make sure that you enroll in a plan that applies the cap. If you're not in Part D or Medicare Advantage plan that qualifies, you could miss out. I'll say that again. If you're not in a Part D in a Part D or a Medicare Advantage plan that qualifies, you could miss out. Okay, so make sure you ask questions. This is a time to lean on somebody like me who understands how these changes work. DM me, comment below. I'll walk you through it for free. And if you're on the live here, just type in the word live, and I'll make sure that I'll give you priority as for somebody that wasn't on this when it was live. So let's move on to another change coming in 2025 that really isn't getting enough attention even right now as we're 4 months into it. All right, the narrowing Medicare Advantage networks in 2025. All right, this is one of those changes that's it's happening, and it's going to catch people off guard. Okay, so those people that don't review things and just think that they can do it themselves and that nothing's going to change, they're banking on Medicare, just Medicare not changing, not anything else. And here's what's happening here is that in January, this has already started and already happened. A number of major Medicare Advantage plans have to tighten their provider networks, and that means fewer doctors will be considered in network. So more referrals will be required to see specialists. You may lose access to your doctors you currently use. So this is already starting. United Healthcare, Aetna, Cigna have announced their provider cuts in several states. This isn't just a rumor; it's happening. And why it matters is imagine going to the doctor in June here and finding out they no longer in your network and now you're stuck. Okay, because you already had something planned. You're going to pay out of network rates, which could lead to hundreds more. Or you have to switch doctors in the mid treatment. That would be a horrible thing. Nothing would scare you more than that. So I'll just tell you also too of a story of about a client. I'll call him Jim. He's a retired truck driver here in Minnesota. He had knee surgery scheduled for March. His doctor suddenly was suddenly dropped from the network. He had to delay care, so he's got to wait now, and I believe it's July when he can get anything done. Start from scratch, and end up with way more bills than he's expected. So, how do you protect yourself? Review, visit with experts like me, um, or anybody else that's an expert. It's I don't care who you go with. Make sure that you go with somebody who's going to give you the best options for you and review everything, not just some product or some service that they want to push onto you. Okay, when the new plans are being released during open enrollment or annual enrollment, make sure your doctor is still network. Get a 101 plan review, like I'm saying with me. You can do it in mine again through chrisnewpower.com/Medicare. Don't just roll over your current plan. These changes mean what worked in 2024 might not work in 2025. And when we're coming up here on 2025, it might not work in 2026. Okay. Consider Medigap, and with Medigap there are no networks, so you can see that any doctor that takes Medicare nationwide. But if you're someone who if you're someone who travels often, wants more doctor freedom, and has specialists outside your area, then Medigap might be a much better fit. Now, questions on networks, again, drop them in the chat or send me a message after this. Uh, Medicare won't cover the popular weight loss drugs that we're seeing now, like Wegovy, Zepbound, and I think it's like Ozempic, is what it's called. The truth is that Medicare won't pay for them. So, in fact, federal law prohibits Medicare from covering weight loss drugs, even when prescribed for obesity. Okay, so why is that a problem? We've got a growing population of seniors with type 2 diabetes, heart disease, obesity related conditions. So these are big things for people to pay attention to. That again, unless if you're reviewing this stuff here, you're not going to know about this. And the worst thing that happens is when you need something, and you don't know that you're not covered for it. It always happens when it's too late, right? And these medications too, when it comes to obesity related conditions, um, when medically necessary, can actually prevent bigger health problems down the road. But Medicare draws a line and says, nope, we're not covering them, even if your doctor says you need them. So what can you do? Again, understand what's covered and what's not. If weight loss is a health goal, you'll need to look into discount cards, manufacturer assistance programs, or private supplemental coverage. Plan ahead for costs. If you're considering a Medicare Advantage plan with wellness benefits, make sure to check if they offer things like gym memberships, nutrition coaching, weight management support. They won't pay for the drugs, but they may help you in other ways. So this is another reason why plan comparisons matter. If you're relying on wellness support or specific prescriptions, you need to match your needs with the right plan. Now, if you want to know which plans are in Minnesota offer the best wellness extras, just shoot me a message after this live. I'll walk you through it. Okay. So um, this is what I would say. Uh, just to start wrapping up here is just start asking your, making sure you know these things like when it's time to enroll, which plans cover your meds, network changes, who covers dental, what happens if you move, or even what the heck is IRMA. If you don't know what IRMAA is, you will want to reach out to me, reach out for that for sure. So go ahead and drop your questions in the chat or comments. If I miss it here, I'll reply personally after the live. And before we wrap up, here's what I want you to do next: book a free consultation with me. I'll do a full Medicare checkup for you, or for someone you love. Follow me here for daily Medicare tips. This stuff changes all the time. So, and also to share it, share the live. If you got value, your friends will too. So again, I just want to say thanks so much for hanging out with me today. Medicare isn't easy, but with the right guide, it doesn't have to be overwhelming. So until next time, stay healthy, stay informed, and most importantly, stay covered.